Hello everyone, I am Riya Patil and today we are going to learn about quinolones. What are quinolones? These are synthetic antimicrobials that have quinolone-like structure and are active against gram-negative bacteria. Though there are new fluorinated compounds recently seen which also inhibit the positive ones. These are called fluoroquinolones. So the first member of quinolones is nalidixic acid, which has usefulness limited to urinary tract infections as well as GI tract infections. So moving forward, about nalidixic acid. It is active against gram-negative bacteria, especially the coliform. So coliform includes E. coli, Proteus, Klebsiella, Enterobacter, Shigella, but not Pseudomonas. Pseudomonas is a particular exception in this case of action of nalidixic acid. So how nalidixic acid works is that it acts by inhibiting bacterial DNA gyrase, and the action of nalidixic acid is rather bactericidal. So what does it mean to be bactericidal is that it kills the particular bacteria. So resistance to nalidixic acid develops rather rapidly. So moving further, mechanism of action of quinolones. So quinolones inhibit the bacterial DNA synthesis by targeting the enzyme DNA gyrase, and it leads to cell death. Then about pharmacokinetics. So the quinolones are generally well absorbed orally with bioavailability ranging from 50 to 90%. They are widely distributed throughout the body including bone and achieve therapeutic concentrations in most tissues. Quinolones are eliminated primarily by renal excretion with half-life ranging from 3 to 5 hours depending on the specific drug. So the dose adjustments are necessary in patients with renal impairment as it can cause adverse effect if not taken that into account. Moving further, what are the indications of quinolones? That is when the quinolones can be used. So quinolones are commonly used to treat bacterial infections such as respiratory tract infections, urinary tract infections, and skin and soft tissue infections. Then what are the adverse effects? That means that after we take a certain quinolone drug, then what it can cause in the body which is not normal. So these are relatively infrequent effects which consist mostly of GI upset and rashes. So the most important toxicity is neurological. That is, after giving it in toxic amount, headache can occur, drowsiness can occur, then there is vertigo, visual disturbances are seen, and occasional seizures are also seen. Then in individuals with G6PD deficiency may develop hemolysis, and they are contraindicated in infants as well. Then let's move forward to multiple choice questions. So the first question is, which of the following is a common mechanism of action for quinolone antibiotics? And the options are A. Inhibition of cell wall synthesis, B. Inhibition of protein synthesis, C. Inhibition of DNA gyrase or topoisomerase 4, or D. Disruption of cell membrane. So as we have seen earlier that the mechanism of action of quinolone antibiotics is mainly about inhibition of DNA gyrase enzyme. So the correct answer would be option number C, that is inhibition of DNA gyrase or topoisomerase 4. Then moving forward to the next question. So the second question is, which of the following is not a member of quinolone antibiotic class? And the options are A. Ciprofloxacin, B. Amoxicillin, C. Levofloxacin, or D. Ofloxacin. So the quinolone antibiotic class contains all the three. These are ciprofloxacin, levofloxacin, and ofloxacin. The odd one out in this, or the four options, are amoxicillin. That is a penicillin. So the correct answer would be option number B, that is amoxicillin. Then the third question. Quinolones antibiotics are commonly used to treat which type of infections? A. Fungal infections, B. Viral infections, C. Bacterial infections, or D. Parasitic infections. So as we have seen earlier that the quinolone family acts mainly on the bacteria, that is gram positive or gram negative one, The fluorinated compound also inhibit the gram positive ones as well, but main activity is against gram negative bacteria. So and action of quinolones is generally bactericidal, that is it kills bacteria. So the correct answer would be it is used against bacterial infections, that is option number C. Moving forward to the next question. Quinolone antibiotics are known for their broad spectrum activity against which group of bacteria? And the options are A. gram positive, B. gram negative, C. anaerobic, D. protozoa. So I told in the earlier question itself that the quinolone family mainly acts against the gram negative bacteria, and the fluorinated compound act again against the gram positive ones as well. So the correct option would be option number B, that is gram negative bacteria. Then the next question is, quinolone antibiotics should generally be avoided in which age group due to potential adverse effect on developing cartilage? And the options are A. children, B. adolescents, C. adults, and D. elderly. So potential adverse effect on developing cartilage is generally seen in the adolescent age group. So the correct answer would be option number B. Thank you for watching.